Mr. Chairman and delegates, I am pleased to bring this report at this our 40th annual conference. We are P&A, an organisation with 6,600 nursing members at its core and two arms with growing numbers of firefighters and paramedics. While the past year has been the most difficult in our history, with continuing deterioration in our members' take-home pay and indeed a significantly deteriorating working environment, it has also been a year in which our branch officers, have demonstrated a remarkable commitment to our members and indeed to this organisation. Over the last 3 years, we have seen over 1,400 nurses retire in mental health alone. Yet you have managed in that time to increase our numbers, albeit marginally. This is a fantastic achievement, and well done to everyone. The next 12 months will see accelerated retirements, especially in mental health services, because of the impact of the government policy on public service pensions. From March 1st, 2012, pensions and gratuities will be based on the reduced basic rate of pay imposed by government in January 10. And this will represent a further challenge to the health of this union. However, its impact on the health service threatens to be horrendous. And I hear you asking, can it get any worse? This week we heard a variety of ministers suggesting if there wasn't sufficient savings from the Croke Park Agreement, then further pay cuts may be imposed. To staff on the front line, this is an extraordinary threat. You have experienced cuts in excess of 20% already. All of the recruitment grades in the public service have experienced a further 10% cut in pay rates across the entire scale. On top of that, you've seen hundreds of your colleagues retire without being replaced. I'm sure, like me, you're asking who is not contributing. What sector is being shielded? I am now calling on government to publish a comparative breakdown of the posts abolished in the public and civil services since 2008. How much money has been saved on non-replacement of retirees across all services? How much has been saved by the pension levy and the pay cuts? Frontline staff like nurses, ambulance, paramedics and firefighters have made a huge contribution. People are suffering because of the cutbacks in frontline services. Colleagues, we have no more to give. The deterioration in the economy has dominated media over the last 12 months. For many years we've been lectured about the value of the private sector. In recent years we were taunted that we were not entrepreneurs, not risk takers, not developers of wealth, the Celtic Tiger era. Now we are burdens on the private sector that created this disaster, aided and abetted by the champions of light touch regulation and the "I'll spend it while I have it" brigade in the former government, not the public sector. A recent front page headline in the Sunday Tormentor, that purveyor of anti-public service verbiage, stated that public service pay has actually increased over the last 2 years. This is, of course, misleading in the extreme. You know, colleagues, that every individual nurse, paramedic and firefighter has suffered appalling cuts in income, appalling cuts in their standards of living, and in many cases are in trouble with their mortgages. I recently examined the pay slips of a senior nurse of over 30 years' service who has been promoted in recent years and is now in a management position. In 2008, for a 2-week period, including night duty and non-social hours payments, he was paid €1,996 net for 2 weeks. He was subsequently promoted and was in receipt of an additional €40 per week. In January this year, he was paid €1,678 net. Now, these payments over a 2-week period represent a reduction, for example, of €159 per week, €318 per fortnight, €690 per calendar month and €8,268 net per annum. That is the reality for our members. Because of staff shortages, we are required to work even harder in looking after our patients, required to take greater risks with our own safety and that of our patients, and be awarded with cuts of around 20% in our take-home pay. For many community-based staff, the cuts in paid mileage have meant that more and more they have to travel at their own cost to maintain services to patients. Additionally, the mileage rate has been cut, and now we are seeing petrol and diesel rates increasing by at least 40% and may go higher. The least we expect is an acknowledgement by the press and by our ministers that our members have suffered these cuts, that they are working even harder on the front line, and that still in their own lives face all the same challenges and increasing mortgage, fuel and other living costs. We are entitled to expect that our loss will be acknowledged. We empathise with those less fortunate, and there are many who have lost even more. If we are honest, we are also a little jealous of the many in the private sector and semi-state companies who have been lucky enough to experience no cuts and in some cases have had pay increases. We are angry, however, at the baying of some commentators who use every opportunity to seek further attacks on public service pay. In recent weeks, our agency nurses fought a battle with their employers following the cut in their agency rates of pay. While the impact of the cuts was to reduce some nurses' earnings by up to 40%, the P&A campaign was not for the restoration of those rates, but for the appointment of those nurses to vacant posts that they were filling. Historically, agency nurses were used to fill locum and short-term vacancies in the health service. The nurses had no security and could be out of work for weeks on end. Therefore, the rates paid were far higher than normal. In recent years, because of the application of the daft, blunt, irrational employment moratorium, agency nurses were used to fill actual vacancies, posts which are essential to the health service, posts the service could not do without. We pointed out to the departed Minister Harney that this was an extraordinary exercise in health service economics. We argued the case for the filling of the posts. We demonstrated the essential nature of the posts, all to no avail. Eventually someone realised we were right. The system was enriching agency owners. The system was unacceptably expensive. The system was not providing value for money. And their response? Cut the rates, and then continue the appalling policy of refusing to employ these nurses. The agency nurses withdrew in large numbers from the health service. The employers then saw an opportunity to save even more money and at the same time starve out the nurses involved. An opportunity for macho management. Give the nurses and the unions a bloody nose. They denied all and every negative impact of the dispute and what was having on patient care. They ignored the risks to patients. Their advice to local managers who called for help, who detailed the impacts on patients, can be crystallised as follows. Oh, that's terrible. You'll have to redeploy staff, and if you can't do that, we'll then just close down the service. And that was the answer given. Eventually, the matter was referred to the LRC on the recommendation of the Public Service Agreement Implementation Body, who found that the HSE had not properly engaged with the unions. The unions agreed, the HSE refused. After a further 10 days of discussion with the NAB, agreement was finally reached that the parties would attend at the LRC to examine the potential for minimising dependence on agency nurses and maximising direct employment. I want to welcome this, and that hearing is taking place on the 26th of this month. But I want also to congratulate the agency nurses on their fortitude. Other issues related to the utilisation and terms and conditions of agency workers will be considered by the social partners in the context of the European Directive 2008/104/EC, due before December this year. As the Chairman pointed out yesterday, the P&A position on this matter is very straightforward. We have core staffing requirements for nursing numbers in our services. Virtually all of our agency nurses that we represent are part of those core numbers. That fact must be acknowledged through their appointment to HSE posts. Colleagues, as you know, the HSE have sought our cooperation with the creation of enlarged catchment areas, which will now equate to the Integrated Service Areas, or ISAs. And this will result in the abolition of half our Director of Nursing posts. They have also sought to change the reporting relationships of our Directors of Nursing, so that where they previously reported to the Programme Manager, later the LHO Manager and now the ISA Manager, they now insist we should report to the ECD. No discussion, no debate, no negotiation. As the RDO said, that's just how it is. Well, we have rejected that. We've insisted on our right to hold our reporting relationships pending negotiation. We also need to have assurances we long-term actors We need clarity as to the HSE corporate view on the future organisational nurse management structures, not just the numbers of directors, but the required number of assistant directors necessary to manage services in the ISAs. At the time of completing this report, further discussions on this matter are awaited. Since 2008, the National Office for Suicide Prevention, the NOSP, has been working with the Irish Prison Service Training and Development Centre at Balad House in Portlaoise and with Aisling Culhane, our Research and Development Advisor, to develop a skills-based suicide prevention training programme to meet the training needs of prison staff. Now, this work is based on a training programme previously researched and developed in Mountjoy Prison Complex. And this partnership has resulted in development of STO4 STOP, Suicide Training Overview for Prisons programme. And the aim of the STOP programme is to upskill key staff within the Irish Prison Service to respond to prisoners who are at risk of suicidal behaviour. The programme comprises of 4 modules delivered over 2 days. 5 established trainers from IPS, along with 4 trainers from the HSE and P&A, have been trained to deliver the programme. And the programme is co-facilitated by pairs of trainers, one from the IPS and a second from HSE and P&A. The training and liaison officers from the Irish Prison Service are key to the effective planning, organisation and delivery of the STOP programme in the prisons where they work. On the 8th and 9th of February 2011, the national implementation of the training commenced. The STOP programme was delivered in 3 prisons simultaneously on those dates, including Arbour Hill, the Midlands and Wheatfield prisons. The P&A is very pleased to support this process. We recognise that prisoners are identified as a key target group for suicide prevention, as research has shown them to be at a high risk of mental health problems, self-harm and complete suicide. Action Area 16 of Reach Out, the Government Policy for Suicide Prevention, recommends the development and delivery of training for staff from the Irish Prison Service on suicide prevention. This is a unique collaborative venture, and we look forward in our continued work with the OSP and our colleagues in the IPS as the success of this programme gains momentum and the second strand of implementation commences. We understand that the feedback from the first initiative has been overwhelming, with long lists of prison officers coming forward eager to commence training. Colleagues, in 1994, 3 of our members were nearly killed in the infamous R10 assault. As a result, a ban was imposed on escorts by the P&A. Under the 2001 Mental Health Act, the responsibility for the provision of escorts, assisted admissions, was placed on each mental health service. In the absence of agreement with this union, the employers contracted an external private agency to provide the service. Under the Croke Park deal, the HSE is now seeking our cooperation with the provision of this service. As an aside, I think it's interesting to note that while we declared no objection to any other grade doing this work, there was no rush to seize this most difficult and challenging of duties. We are now in discussions with the employers to establish the conditions under which our members would return to this role. Our main concern is to establish arrangements which are safe for the client and the staff. In this regard, we have sought transport which is safe. There is ample evidence, for example, that saloon cars are unsuitable. Indeed, it is clear that we need vehicles in which a driver cannot be interfered with by a person who becomes disturbed during transportation. We require training which equips nurses with the full knowledge so that the rights of persons being taken into civilian custody will be ensured and protected, and training which will ensure that each member of the team has current, updated training in de-escalation techniques, prevention of violence and restraint. We require that teams are called in from off-duty staff. And this is hugely important. Over the last few years, our nursing numbers have plummeted. We rarely have staff numbers appropriate to the needs of clients in our units. Against this background, it would be inappropriate and unacceptable and an affront to safe practice that any of the team would be taken from depleted staff complements. And that's been conceded already. The principle of voluntarism will be enshrined in any final agreement, and that's been agreed already. One of the concerns which has emerged in recent consultation with members is the lack of appropriate service in which to admit some of our clients to. For example, being required to assist in the admission of an older person into a unit which is not geared towards catering for their needs, or an adolescent to an adult unit.